When working with teen clients, I have times that during family sessions the parent is reporting significantly lower scores on the ORS than the teen has been reporting during their individual sessions. Of course, this becomes part of the clinical conversation, but why do you think the significant differences in scores happens?
Well, it's really what I would predict. I mean, that there would be difference in scores, different viewpoints. Oftentimes, kids are mandated to treatment. Mandated people tend to score the measures high. Again, not because they're lying or misrepresenting, because they are the ones that are not distressed about the problem. Kids are rarely distressed about the problems that parents drag them to therapy for. So, there's likely to be. Actually, I wouldn't say surprised, but I'm mildly surprised when parents and kids' ratings are similar to one another, although it certainly happens. If you've seen my workshops, you know that I show both examples, when they're different and when they're together. So when they're different, like you say, I'm glad you added that to it. It provides, real good grist for talking about the difference and what needs to close, what can be done in session to close the differences, and what can happen both outside and inside of therapy that will allow the parent to view the kid more in line with the kid's view of him or herself. So that's the kind of discussion I want to have. But it's not surprising to me that when kids are rating themselves, they're not going to rate themselves at the same distress level that their parents viewing the kid will rate them. So I think that's the best explanation for that. Now, the thing that I find incredibly interesting, and we've seen in the data, is that when the ratings go up, even if kids' ratings start high, say the teenager's rating is 29 or 30, and the parent's rating is 15 or 16, what we notice is that when one score goes up, so does the other one. So there's a pretty strong correlation, in fact a significant one in our study, between parents' rating of change and the kids' rating of change. So while they may start off really different views, they both still will recognize change when it happens, which is